Hi there, I'm Dr. Stephen Phelan. Welcome to Dental Excellence. And for today's video, I'd like to return to another example of long-term success with porcelain veneers. So for this video, I'd like to share with you a 15-year post-treatment result for a patient. And I shot these photographs about 2 months ago as well, in the fall of 2014. And as I've said in the previous Dental Excellence videos, I'm dedicated to creating long-term results for my patients. So I'd like to share these long-term case reports and case photos just to show what kind of results we can get with really conservative veneer preparations. And so here's the case. This is 15 years post-treatment. So 15 years post-preparation. And you can see the veneers, they're Empress veneers. They're actually Empress veneers that I did a long time ago. It was my AACD accreditation veneer case. So it's 8 veneers. You can see a couple other views. Again, the tissue looks amazing. The structural integrity of the porcelain veneers, the margins, everything looks great at the 15-year mark, which is awesome to see. And when I have patients ask me, oh, well, how long can my veneers last? And I say, well, you know, every patient has their own risk profile and issues that can affect the longevity of your restorations. But if we do our job right, you have a good chance of having most of your restorations in place in 15 years. And chances are we won't have to redo your case at 15 years unless you want to change the color or the aesthetics. But you might lose one restoration, you know, and would redo the one restoration. That's usually the conversation I have with patients when they ask about longevity, especially with porcelain veneers. So we didn't redo any restorations in this case, but occasionally you have to redo a restoration. And I'm okay with that, as long as we don't break the tooth. If we break the porcelain, no big deal. We can redo that. It's not a big problem. And if you look at the retrospective studies, especially work by Mauro Fradiani out of Italy, he shows about 97% success rate at 15 years, between 10 and 12 and 15 years in his retrospective studies. And so that's excellent. You know, that's pretty much what I see in my practice. And one of his retrospective studies, the paper I read, he said that failure with the porcelain restorations, the cases that failed, basically it wasn't the whole case that failed, it was just a restoration here or there, like I've said. Failure is basically attributed to preparation design with preparations that are largely on a dentin instead of enamel. So they noticed that with the failures, and occlusion. Those are the two things that cause veneers to fail and cases to fail. Over-preparing the teeth, big issue, and occlusion. So if you can get those right, you have a good chance that your patient, with proper risk management on the patient's part, you know, being reasonable with what they eat, and if they grind their teeth wearing a splint or some kind of appliance, with proper risk management, they should be able to maintain the restorations for quite a long time. I'll be interested to see 20-year post-ops on this case. You know, that'll be awesome. I'll post those everywhere because that's cause for celebration, you know. Excellent 20-year post-ops on a veneer case. That's awesome. And it's nice, you know, part of me is kind of like, oh, I've been in practice a long time. But the nice thing about being in practice a long time is you have great longevity that you can document with your cases. Because this case, actually, when I originally treated this patient, I was shooting slides because it was AACD accreditation. I was shooting ectochrome slides. So these are digital photos, the post-ops. I did scan one slide that I'll share with you, the one pre-treatment photo. Here it is. That's the scanned slide of the pre-treatment tooth position of the incisors, and I guess you can kind of see the cuspids. So, you know, she just didn't like tooth shape. There was some spacing, some unevenness. She had ortho twice, and it couldn't resolve this. It was kind of a tooth size, arch size issue. And we were able to give her a beautiful, long-lasting result. And again, I think that conservative preparation with veneers is critical. but you have to taper in the incisal third, as I've said in different videos. And if you look here, this gives you a good visualization of the way I kind of design the preparation. Really conservative, but just taper that incisal third a little so they don't get the veneers sticking out, or any of the restorations sticking out a little too much protrusively and looking a little prominent, or more prominent than we'd like. And then what this also shows you is the sagittally sectioned vertical putty stent. And this is the way I look at it. I'm looking at basically the veneer in cross section when I look at this putty relative to the preparation. It's basically the veneer in cross section. So it's kind of cool to see. Here's another view of the prep of the 10-year post-op case. This is actually the die from the 10-year post-op case I shared in Dental Excellence. And this was the lateral view of the 10-year post-op case. I threw these in because at that point, 10 years ago, I had a digital camera. So I had all these digitized. They were actual digital photos. So that's the die. And again, I'm pointing out that I'm tapering that incisal third a little bit. So, 10 years ago, roughly 10, 11 years ago was when I switched to digital photography. I think 2003, roughly 2003. And it's great because I have so much documentation. It's actually pretty fun. And, I've been in practice 23 years now. When when I hit 30 years, I'll have so many cases, it'll be unbelievable. Because I've been documenting so many cases since probably 96, 97, documented pretty much everything I've done. So yeah, it's kind of fun. I'm excited to kind of get everything together one day and just look at it. That would be pretty cool at 30 years. And so we posted this case on Facebook, just on my Phelan Dental, or I think I posted on Phelan Dental Seminars and maybe even on Dr. Stephen Phelan, my 2 pages. And we had a tremendous interaction and likes, comments, and shares with this on Facebook. People liked seeing long-term results. It was neat. And it's not a super white case. It's just a nice aesthetic case. Not super white, but it's appropriate to the rest of her dentition. So it's a nice aesthetic integration because it's only 8 units. It's not a full mouth case. So just remember, you can do this kind of dentistry. Remember that. You can do this kind of dentistry, and beautiful dentistry with precise fit and occlusion is not just for the gurus.